Welcome back to Lymphedema Care and Management with Frank. Today we're going to take a closer look at the superficial lymphatic system, which is a key player as to why lymphedema develops, and it must be considered when planning effective treatment. What is it? So the superficial lymphatic system is a network of vessels located just right under your skin, mainly the subcutaneous tissue and the dermis, and has been estimated to be about 1 millimeter deeper into the skin, which is the thickness of your nail bed. The main job is to transport lymphatic fluid, which consists of water, protein, waste products, and immune cells from the skin and the soft tissue. It must be delivered to the lymph nodes before it can be transported deeper and eventually end up in your bloodstream. So why does this matter? Because it plays a huge role in regulating swelling and inflammation, specifically after surgery, trauma, or conditions like lymphedema. When this system becomes overwhelmed and eventually damaged, fluid builds up, leading to progressive, persistent swelling, fibrosis, infection, and other complications if not managed properly. So clinically, the superficial lymphatic system runs right under your skin, and it follows predictable anatomy pathways, ultimately draining into groups of lymph nodes like the axillary and inguinal lymph nodes. So during manual lymphatic drainage, we use these pathways to guide fluid, making them critical for effective lymphedema care. So now let me demonstrate. The body is divided into quadrants by these black lines, or what we call watershed: clavicular, sagittal, and lower horizontal. And we have some in the anterior and also in the posterior, the upper, the sagittal, and lower horizontal. Each quadrant that you'll see here has regional lymph nodes. So the axillary lymph nodes will accept drainage from the arm. As you see, these collectors bring lymphatic fluid to the axillary lymph node. It also accepts from the anterior upper quadrant as well as the posterior upper quadrant. So if this lymph nodes were out or damaged, you'll see swelling not only in the arm but also the anterior and posterior trunk of that quadrant. This is important when treating patients. Keep that in mind to treat the trunk as well as the extremity.